Today we're going to talk about finding food freedom and kind of talking through NDSU student health service today. So, like I said, I work both with athletics and student health service, providing education and counseling services to students and athletes. And within our student health service, we are a full clinic of nurses, nurse practitioners, providers, um, dietitian, x-ray services, lab, and then also our health promotion. So I have worked in multiple healthcare facilities, and this is, I can be biased to say we have all worked like interdisciplinary and worked together on every case and every patient together. So it's been awesome. We have Joanna Johnson here as well, who's our psychiatric mental health provider. So also adding that this past year to really focus on mental health with patients specifically. But what's the scoop today? What are we actually going to be talking about? Is we'll briefly talk a little bit about eating disorders and the definitions of them. With student health services, we are all educated in eating disorders. However, we know our scope and making sure that we can best provide the resources and referring out patients if they are diagnosed with eating disorder. We have really great partnership with Sanford, their eating disorder unit, so making sure we can get patients, students, and athletes to the best resources that they can. Then we'll really talk about disordered eating. So what's the actual difference between the two? And then food freedom and what that actually means. And then lastly, really having those tools in your back of your toolkit to use for yourself, using with other students, working with maybe coworkers, anyone that you can be the best support system in their lives. So, eating disorders can be very commonly just brought out there and sometimes harshly. So I kind of like to break some of those barriers and just understanding what each eating disorder is. So per the DSM-5, it is diagnosed as defined as eating disorders are a persistent disturbance of eating or eating-related behavior that results in an altered consumption or absorption of food that can significantly impact the physical health and psychosocial functioning of an individual. So when we think about some of the common eating disorders, there's anorexia nervosa, which is the restriction of food consumption, which can be associated with muscle wasting, a low body weight, and then many times it's rooted in the fear of weight gain, weight restoration, or food itself. This can commonly be triggered in the fears with also the bulimia nervosa. So this can be found with episodes of binge eating or overeating. Then also has symptoms of self-inducing vomiting or involuntary purging. And then binge eating disorder, similar to bulimia nervosa, but it doesn't have that physical action of purging or self-induced vomiting. One common and new eating disorder that has been found recently is ARFID, which is avoidant restrictive intake disorder. So our kind of first three eating disorders are many times rooted in the fear of our weight, our body, and food itself. However, ARFID is a fear that's associated towards like choking, sensory of things, or even food itself, as they feel like if they eat something, they might vomit about that food. So this is kind of the restriction of food or a variety of food because of the taste, the texture, the sound of it. How many of us don't like styrofoam, like scraping together, or a chalkboard? Like, right? Those are sensory things that we can't stand. That's kind of some of this association towards food. So sometimes the crunch of a chip, sometimes be that fear associated with something. Then other specified disordered eating. These are not classified in the DSM-5, however, are extremely important to note, as many times these can be things that can be found in a lot of our patients and student populations, is our atypical anorexia nervosa. So this is similar to anorexia nervosa, but it's not showcasing those physical criteria. So we are having the restriction of food, but we may not see that weight loss, or they may not be at a low weight for their age and height. The purging disorder, so they might be eating a typical amount of food or what quote unquote normal. However, they might still be experiencing self-induced vomiting or inducing some of that purging. And then night eating syndrome. So this can be found if after their mealtime or they're found awakened at night to then eat or have episodes of eating throughout the night. Patients and students are aware of these behaviors, but sometimes reckoning some of that root cause can be difficult to do. And then orthorexia, which has been more prevalent in this kind of decade generation, is this kind of the association towards fears of specific So what is quote unquote healthy or non-healthy or unhealthy. So this can be the avoidance or restriction of certain foods so that they find unhealthy versus healthy in that way. So what's the difference? So eating disorders are diagnosis, and many times when we think about disordered eating, it can be a lot more common, but we're not actually diagnosing someone with something. So this is actually thoughts, behaviors, and attitudes towards food that can be irregular and then may not meet that clinical criteria, but still can impact the mental health and physical functioning of an individual. So some of these triggers can be rooted through lack of time, lack of access to food, the lack of money. And as we kind of know students, sometimes those are three things that are really huge. So recognizing those. Additionally, sometimes it's still rooted in that fear of food or some of the knowledge that we have towards food and nutrition. So recognizing that these things are found as quote unquote normal, and sometimes the diet culture that we're being influenced around, or some of the media that's spread around with nutrition or health promotion. So recognizing that these are things that can be found in just our normal day-to-day world, but that can root through some disordered eating that can sometimes be longer escalated towards eating disorders. So what can we kind of do to kind of focus on ourselves, even check in with ourselves? So if you have a notebook or you like to keep track in your head or you like to keep track with your fingers, I'm going to kind of read each of these out. And if you can kind of take note if these apply to you, maybe putting that finger down or thinking, okay, that one does one, that one does two. Just starting to kind of quiz ourselves if some of these apply to how we think of eating. So one, you skip meals or eat inconsistently due to being too busy or stressed with your schedule. You feel guilty after eating certain foods and or treats, quote unquote. You feel like eating out during the week will, quote, ruin everything. You start over every Monday with your diet or say, I will be better tomorrow. You are thinking about food constantly, even after eating a meal. You restrict foods or, quote, save calories in the day to find yourself overeating a lot at night. You believe that there are, quote, good and, quote, bad foods. You try to, quote, cut calories or go on a diet before a vacation, summer, or a special event. You spend a lot of time worrying about what to eat or how much to eat. You eat and buy less food because your money is tight. You avoid eating with others out of a fear of judgment or a lack of control. And you work out to, quote, earn your food or more food than usual. So, right, if you feel comfortable, and just kind of a raise of hands, how many of us maybe have ever thought like this or even just one of these things? Right? It's so common that it's present in our lives on a day-to-day basis. So just starting to think about it, these are things that are so kind of, quote, normal to us, are kind of thoughts that we're falling into these disordered eating patterns. So what is food freedom? That is ultimately the unconditional permission to eat what you want and consistently honor your hunger cues in order to rebuild trust with your body. That is, it's a lot easier to say that definition than to be done. So when we think about that as a broader term, that's ultimately ditching this diet mentality and ultimately breaking from these food rules that might have been set by others or even set by ourselves. We have a lot of expectations for ourselves, whether it's personally, professionally, just in a lot of things in our life. Sometimes food could be a lot of that control we like to have over too. And ultimately, as a dietitian, my approach towards students in counseling is always helping them feel for their performance, their academics, but also life. So recognizing what we're doing now is not only going to help us this season of life, but also every other season we got to take on. Because, right, one birthday is going to happen next year after that. So how do we navigate those things? So how do we start building those toolkits? What can we do for ourselves if we're kind of thinking like that, or having some of those behaviors or thoughts or attitudes? And how can we also help students, coworkers, our support system out there that might also be struggling with some of these thoughts? So one, like I said, ditching that diet mentality. So the biggest thing that we can do is start to recognize, where is this diet culture showing up in our life? And right, my biggest quote I always like to say is, self-awareness is the biggest barrier and enemy of self-acceptance. So what I mean by that is, if you're like, I really am following this person, I don't like how they make me feel, I feel bad about myself, but whatever, I could look like them one day if I tried harder. right? We kind of are aware of it, but we're just not accepting the fact that this is affecting us in a really negative way. So this can be by turning off TV ads, unfollowing people that might make us feel bad about ourselves, ultimately even just kind of steering away from conversations that might be towards food, diet, our weight, or anything that honestly just doesn't make you feel good or uncomfortable. It's okay to walk away. And then if you're really not sure, one of the biggest questions that we can kind of ask ourselves is, does this make me feel bad about myself and my body or my food choices? If so, it's more than likely diet culture. Now, if this is having a journal, a phone's notes app, or a kind of a private phone app journal, can be a great way to kind of take those notes throughout the day and just start recognizing how it shows up in your life and what we can kind of do from there. One question then I have that a lot of patients and students might ask me is, like, who do I follow then? Right? If I'm gonna unfollow these people, I still gotta be on Instagram. Like, who do I follow? And they're not wrong. So 3 things that we always look at is look into them. If you are gonna find people online, and especially if it's nutrition information, is see who they are. Who are their credentials? What are they kind of promoting? Kind of what do they do for a living, even, right? So recognizing if they're not a dietitian, what are they trying to do? What are they trying to promote to you, and what do they say? Kind of going back to that first question is, does this make me feel bad about myself? Am I going to want to keep scrolling through this feed over and over again? Then are they trying to sell you something? So I speak this from personal. I was a dietitian who had a business on her own all through social media. So, right, I always like to say, check what they're selling you. Are they selling you a service, counseling program, a coaching program that's one-on-one, it's personalized, or are they selling you a supplement? How many of us has TikTok? Nobody have TikTok? Oh, wow. I gotta delete that off. How about like Instagram? No, right? Instagram. Okay. But even if there's things that we use, is there ads that ever show up? How about like even when we're scrolling on the web, are there ever ads that like show up for things? Yeah. They're kind of personalized to what we're looking at. And as you can probably guess, my nutrition feed is filled with lots of nutrition aspects. But speaking on our students, a lot of them have the TikTok, they have Instagram, they have every social media platform out there, and that's all that they're seeing. So recognizing, are they selling me a supplement or a product, and is that constantly what their message is about? The new biggest thing has been this cortisol, the stress-reducing pill. So that's been the biggest thing. It's been like a greens powder in the past that would de-bloat you. So there's always going to be something new. Does anyone want to share? Was there anything as like a kid, teenager that like was promoted to you that you were like, oh, this will like help me lose weight?
I remember being like, there were pills, like just over the counter. I don't know if they were caffeine pills. Dextrose.
Yeah, like Dexedrine or something.
Yeah, it was like
Something.
Dexa something.
Yeah.
But yeah, or like there's like a Freniator or Hypo Trimster. I don't know.
Like the fat boosters or the
Yeah.
metabolizers.
And I don't know if those are sold anymore in like Walmart, Target. Now it's like that shot you have to go get at the clinic.
Yeah, I think in high school too, they had maybe come out with like, I just remember other girls doing this. I wasn't one of them, but chocolate X-Lax came out, right? These little chocolate X-Lax, right? So then girls would eat that,
Yes.
right, to keep their weight down, to go to the bathroom so that they
I remember that. Now that you say that.
yeah, they don't gain weight.
So all these new things that always come out, right? There's apple cider vinegar, like what they would do for you. There's always going to be something new. And I always stress that to students. I'm like, is this a new thing? Is this a new thing? What's next week? Right? There's always going to be a new thing. And sometimes it's not going to be sold anymore. That's a huge red flag, right? Is what are they promoting us? Is it a product that they're like, hey, click my link, here's my discount code?
It seems like every quick fix medicine that has been sold for weight loss at one time or another, if you fast forward 10 years, maybe this is really aging. But that's not around anymore. Right. But there's a new quick fix that's around. And I've seen it from a family friend that goes to one of the local doctors in town here. And she does a shot and she gets all skinny and then she goes off of that shot and then she gains all her weight back and then she does it again. It's like cycling.
It can be hard because that's what we know, right?
Yeah.
The biggest thing is that we only know what we know. So who we follow and who we're being influenced by may not be what we're being educated.
But also our medical professionals are selling it.
So
Local health clinics are doing it. So
But as Carrie and I
another-
say,
I'm a dietitian.
that the thing is that people who aren't nutrition experts aren't selling that product.
it's the
There's other professionals.
The gyms that you just push.
So there's different things that are constantly being pushed and or said this is the next thing to do. So when it comes to many times it may, where we're at now might be someone who we think is a trusted individual or professional. But for a lot of our students, their trusted individuals are people online. So those influencers. Well, they get me. They understand me. They're an athlete. They know exactly what I've gone through. But they're a professional in their own life, not the person we're talking to that way. And that kind of goes with the same thing. So those one size fits all, pay $6.99 for this meal plan, or here's this coaching program that everyone follows. Do this, right? It's a one size fits all. And as I always tell students, is a meal plan. You're gonna want to follow that for the rest of your life, or we can follow for a week. Let's see how that goes, and let's see how next week goes. We're creating a lifestyle, not a meal plan. Create a template. It's awesome, but how do we play around with it in that way? And then the last thing is, do they use words like unhealthy, good, bad, limit, avoid, all those catchy red words that like to just be posted online? Those are kind of the biggest signs for our red flags. Is who do we follow and who should we maybe I don't follow them this time. So we talked a little about ditching that diet mentality. Kind of talked about, okay, if we are going to still follow people, who do we follow? Now we actually go into the roots of food freedom. Is really tied in the roots of intuitive eating practices and mindful eating. And so I know Carrie's just smiling, right? This is what we love. However, mindful eating can be hard. It's ultimately being mindful about what we eat and when we eat it, how we eat it. Now, thinking about food can be hard in general, so I always like to say let's start it at meal times. And so one of the biggest things I always use is our hunger fullness scale. So how many of us have ever gone into a meal, really ravenous, hungry, oh my gosh, I'm so hungry. Yeah. And then if we eat that meal, are we feeling pretty full, pretty uncomfortable? Pretty sick sometimes? Yeah. I would like to say the scale also follows as a pendulum. So if you're going to go in really, really hungry, you're more than likely going to feel sick. Getting us to feel guilt, shame, feeling don't feel good. It's my weekend goal. However, if we went into that same meal, a little bit hungry, I could eat something, we'd more than likely still feel maybe more comfortable, a little bit satisfied, feel in that way. So sometimes I'll even put this observations in students, they'll carry it around at meal times to say, how do I feel? Okay, if I'm starting here, I more than likely might find myself like this. Then we'll kind of look at that and say, okay, maybe we got to look at these gaps between meals. Are we having 6 to 8 hours before we eat? How do we get maybe a snack to kind of boost ourselves to feel at that 3 to 4 versus that 0 to 1? I was like to say, if any of us gotten hangry, we're not the best friends. We're definitely not the best teachers. We're definitely not the best coworkers as well. So focusing on that hunger fullness scale, but when we're actually at that meal times, is also avoiding those distractions. So making sure we don't have our phone, we don't have a TV show going, maybe we're present. That can be really hard to be in silence or with friends or with our family. It's just kind of having that meal time as a meal. Now this can be hard for some students too, is biggest trick that I'll talk about is separating our spaces. So for students, we'll say, okay, we're gonna have a place that we study, we're gonna have a place that we eat, and we have a place that we sleep. All of them have different feelings associated. I definitely would not want to study and be stressed where I gotta sleep and be restful. Right? We're gonna carry those emotions of stress and unrestfulness in a place we want to be restful. So this might be looking like, okay, I'm gonna eat in the dining hall. If I have a snack, then maybe I'm gonna go eat that out in the lounge outside my door. And then if I'm gonna sleep, I'm leaving that straight to my dorm. I hope they're not sleeping anywhere else except for their dorm or their apartment, wherever they live. And then if I'm studying, I gotta go find another space for that. Maybe that is in the lounge that's still in my dorm facility. Maybe that's in the science building. I spent a lot of time in the science building on the whiteboards. Or maybe I'm finding that in another gathering. Is separating our spaces so we aren't making this eating place not mindful. Because how many of us have ever eaten something when we're watching a movie, TV show? Any of us been like, why am I still eating this or the bag's empty? right? We're not mindful when we're eating those things. Also kind of being a food critic. So, right, if it's really hard to be in that silence, especially some students might be like, it's really difficult. I can only eat slow if I watch a movie. Okay, then let's focus on the senses of food. Right? You're a food critic. Let's focus on how it tastes, how it looks, how it feels. Using those different senses allows us to actually slow down and think about what we're eating. Setting down the fork or using our opposite hand. This can also be a tool too if you're like, I still need to watch a movie, or I really don't like thinking about how I'm eating something or the texture of it. Then let's use our actual physical ways. How do we set down our fork after every bite? How do we use the opposite hand? I do it in private at first because it might be a little bit hard, but then starting to bring that into public, you'll slow down that eating there. And then recognizing that why, or checking in midway. So sometimes we might find ourselves going up for seconds, or students are like, I'm in the dining hall, so I have to go up. Is maybe if they're going up for desserts or they're going up for seconds, we're checking in. It's checking on our hunger and fullness. Where are we at? And then if we are doing our reasoning why, is okay, what is the purpose of what I'm eating? Am I going to feel great after this? Right? We still want to enjoy the foods that we want, but also recognizing that physical fullness, which we'll kind of talk about next. Is recognizing our reactions or the why towards food. Are we eating for our emotions, or are we eating for our physical fullness? How many of us find ourselves getting really if we're stressed, sad, angry, we just find ourselves snacking on things? Anybody? I'm definitely emotional. So when we have those emotions, right, they can sometimes going to be more overweight to us. We might find ourselves maybe eating less. We might find ourselves maybe eating more. We might eat different foods that we might crave. And the biggest thing as a dietitian is I never tell them to limit or avoid something. We look at where we can add. So when we think about our emotional hunger, it many times comes on suddenly. It's rooted from an emotion that we feel. It's going to feel like it needs to be satisfied instantly. You're like, oh my gosh, if I don't get this, life's going to end. It can be craved by our comfort foods. So if there's specific foods that we're craving. If it isn't satisfied with a full stomach. So you might be like, oh, I'm really full, but I'm still really thinking about this food. Or it's triggered by feelings of that guilt or shame. Oh, I ate so much at dinner. So I'm already here. I'm this far. Versus that physical hunger comes on gradually. You can start to see it irking up. That scale slowly creeps down. It can wait, right? We're I'm really hungry, but I might find myself hangry if that scale keeps going down. It's open to options. We're willing to kind of eat more foods that are around us. Additionally, hunger stops when we're full. We're okay, I feel satisfied. I'm there. And then we doesn't make us feel bad about ourselves. So if we are honoring that hunger and fullness scale, we're more than likely feeling satisfied. So when I talk about honoring both emotional and physical, how many of us have ever craved a specific food? Right? A specific one. I'm a chocolate chip cookie sounds so good. Well, what if I just ate an apple? That's a lot healthier, right? If I eat that apple, it definitely is not a chocolate chip cookie. So I'm well, maybe I add peanut butter and chocolate chips. That's another option. We might find ourselves eating more food, but not satisfying that emotional hunger. So what I like to tell students and patients is, okay, how do we take that chocolate chip cookie and add to it? How can we add some of that maybe protein, make us feel physically satisfied, or some of our color? How do we add fruits, vegetables? Probably not vegetables with our cookie, maybe some fruits to help us feel physically satisfied with that. So we're honoring both our emotional and our physical hunger at the same time. And then redefining healthy. So this is kind of one of the things that I would say is to kind of do first if you're struggling with kind of healing your relationship with food, but also to check in a couple times in a couple months. So I always kind of indiscreetly ask every student when they walk in, talk with me. I said, what are you hoping to get out of this? What are you hoping to get out of our conversations? Whether it's a couple weeks, a couple months, or it's the whole year. And many times it's rooted with numbers. It's rooted with, I want to have more energy. I want to lift more weight. I want to lose 15 pounds. It is always rooted to one thing. But then at the end, when I'm closing up with the student, I said, well, I want to just ask you, right? We've had these conversations. What does healthy mean to you now? And it has been always eye-opening to see these definitions change so drastically. Is now we've focused on, oh, I feel like I have more energy, but I can still enjoy the foods I want while still gaining strength. I feel good during my workouts. I now can eat foods and have energy to now swim. I want to be a parent and also be able to run after my kids one day. It's rooted towards my why. Why am I being healthy? What does this give me purpose for in that way? So even if we're doing it today, it's taking that 15, 30 minutes to just write down what does healthy actually mean like to you? What does it feel like? What does it look like? And then if we're finding ourselves healing that relationship with food, practicing some of these tools, is to then check in and say, okay, why am I doing these things? What does healthy actually mean to me right now in my life? And 80, right? We're gonna live till we're 80, 90, I hope. So recognize that we can focus on that too. And then seeking support. The biggest thing is your support is your biggest success. So if we don't have that support system, we might not find that success as well. So this can be kind of our friends, roommates, family, if present, and just having those conversations of like, hey, this is what's going on. I just want to have a support system. It's kind of what I need. However, sometimes this can be hard and challenging conversations. So having that support system with a dietitian, that's me on campus. It's no charge to students. So it's an excellent resource for students to use. And like I'm in student health services on Thursdays and Fridays. So students are available to kind of schedule an appointment. First appointment is for an hour. It's honestly just to kind of chat, learn more about each other. I know it can be intimidating to meet with a dietitian because what the heck is she going to do? Put me on a diet? It's in my name. So, but it's ultimately breaking some of that ice, having those conversations and building that relationship. We then meet every kind of 30 minutes every 2 to 3 weeks to check in on goals and then kind of see that go out, whether it's a couple weeks, couple months, or the full year. No way. We also have, like I said, medical providers. So if we are kind of noticing, if you're finding students that you're like, okay, I'm kind of really concerned that maybe these disordered eating might be a little bit more. Right? We don't want to assume, but we also want to be supportive of those students as well. Joanna Johnson's great for our mental health provider, so kind of even counseling out that we can get them the support that they need with our supporting partners around Fargo as well. And then the counseling center, so recognizing that healing our relationship with food is one aspect. I talk about the nutrition, I talk about the food, but ultimately we want to heal that relationship we have with ourselves. So having those conversations with the counseling center can be a great support system along the way. And then, right, if I said, right, we've talked a lot about more of our relationship with kind of our body, our thoughts and feelings that might be more fear restricted. If we are more fear restricted towards like money or kind of food availability, NDSU has some really great resources around town. So kind of been pulling from First Link, the Emergency Food Pantry, Great Plains Food Bank, the Little Free Pantry. And even if we feel as though it's kind of a concern, even kind of reaching out to case management to see if they have other resources to support the student in that way. And we make it really easy to schedule an appointment because I don't know about you, but graduating and like for the first time ever having to call to make an appointment as a student, it's like way too hard, but some students got it. They can call. However, the most popular is logging into their student health portal online and scheduling the appointment there. It's super easy, especially scheduling with a dietitian. They schedule if they want it in person, or I do telehealth, so we can meet via Zoom. I'm licensed in Minnesota and North Dakota, so when they do go home, if they're in Minnesota and North Dakota, we still continue over the summer. So that makes it a really great resource for students as well. But really easy, so they can schedule their appointment. They do all their forms online. Or they can come in person. If they stop in and walk in, many times we have some walk-in appointments with the providers or nurses. And then if they have a walk-in with the dietitian, many times we can squeeze them in as well. So I did a lot of talking. These are some quick podcasts as well. If you're a podcast listener, you love to listen to other people talk about it. These are some really popular ones that are really rooted on that mindful, that intuitive eating practices, and ultimately kind of healing that relationship with food. I realize that students aren't on the podcast grind anymore, so I got to find TikTok accounts to add to my list. It's not. But kind of leaving this space, I wanted to just kind of give you guys that information, education on things that you can do for yourselves that are students and self, the resource that's available. But if you have any other questions kind of regarding nutrition, student health service, just in general nutrition, my ears are open. And then also I have a QR code that has kind of a handout that can be used for students as well. It's kind of finding food freedom at NDSU. So it has all those tools that we talked about today, but also the contacts for the resources. Any questions?
And then your services are free to students, right? And so all they have to do is called, set up. They don't have to be referred.
Nope.
You or anything like that. They can just be like, I'm gonna have a conversation.
Yep. And that's kind of where a lot of, even like when it comes to meeting with a dietitian, sometimes they're like, well, do I have to have like a diagnosis? Like I meet with students who might have a diagnosis. They might have an acute issue. It might be a chronic illness. It might just be like, I want to learn more about nutrition. It might be food freedom. It could be anything nutrition related. They can come and chat about.
Approaching students that you're concerned about is hard for me sometimes, but of course, being an instructor in dietetics, we do see it sometimes. Do you have tips on that? I usually reach out to them, just ask if they'll meet with me, and honestly just kind of ask them how they're doing and how things are going, and kind of more open-ended, and usually they will kind of open up, but a lot of times I might just say, your affect seems different or your energy levels seem different, trying to get them to open, or this is what I'm observing, might not be how you're feeling. But do you have tips for me on that? Because it comes up from time to time in my position.
And that can be really challenging because sometimes when we approach a student, it can sometimes exacerbate or even make them feel like, okay, well, now I gotta put on another kind of shield so no one sees these things.
Yes.
So I would say just the way that you're kind of doing it already is approaching them in a manner that's like, I care about you. This is what I'm noticing. And recognizing that it's like, okay, can we have this conversation together or would you be open to kind of chatting with someone else about it too? And that's kind of something even as a dietitian, I see it a lot with our athletes is right. I see them every day right out the fueling station and they make a lot of comments. So having those conversations can feel really like, oh, I had that conversation, but it's like, oh, this person cares about me. So I can be open to talking to them about it too. Okay. That's all I have for you. I appreciate your time and looking at all my fun little food graphics.
So it's a real cute.
But if you do have any questions that come up afterwards, my email's there. I got married in April, so obviously my name is not the same. But you can find me, I think, with both Kaylee and Scary or Kaylee Jetman. But I follow that email. So that's all I got for you. Thank you so much.